Artificial intelligence currently used by astronauts in space could soon be helping the NHS in England to diagnose bowel cancer.
High-speed satellite technology is being developed by University College London so that cancer can be detected from live colonoscopy video. Our health and science correspondent James Gallagher went to find out more.
Doctors are on the hunt for the earliest signs of bowel cancer. They're performing a colonoscopy and manoeuvring a camera around the patient's bowels. They're searching for little growths called polyps, which can become cancerous.
The biggest challenge is to detect precancerous polyps, little growths in the bowel. We know that about 1 in 5 polyps are missed during colonoscopy, and we want to do anything we can to improve that detection rate. Anything we can do to improve detection will reduce cancer incidence significantly.
So could this computer software help doctors? It's an artificial intelligence that's been trained to spot polyps in real time during a colonoscopy. And there, in the green box, is a polyp spotted by the AI. But this is useful only if doctors have access to a powerful computer with the right software. So the researchers are also turning to space technology to see if they can use satellites to connect any hospital in the world to the AI. Clinical trials are planned for next year. James Gallagher, BBC News.
It's all very sort of sci-fi, actually, isn't it? We're joined by Peter Mountney, who is the leader of the Earth Scan project. Morning to you.
Morning.
Yes, we've seen that piece, but just explain to us how would this sort of space technology help?
Absolutely. So we're building a system that can improve the early detection and diagnosis of cancer. So currently, a patient may go for a colonoscopy and their doctor is trying to spot small polyps or small pieces of abnormal tissue. So what the software that we're developing can do is to take that live video stream during the procedure, send it securely to the cloud, where it can be processed using artificial intelligence or machine learning algorithms to help identify where those polyps are and help make diagnosis.
So essentially you wouldn't need to do the other process. This would sort of do it for you, is that right?
The tool supports the doctor to find cancer more effectively and make more effective diagnosis. So currently when a colonoscopy is performed, up to 20% of those polyps could be missed, and this software is trying to improve that.
And if you find them, I mean, we all know about cancer diagnosis, and I think it's particularly relevant, or at least it is with bowel cancer as well. Early diagnosis can really make a difference to people's lives, can't it?
Absolutely. So finding those small polyps is incredibly difficult. They can be flat and can look like healthy tissue. So identifying them early dramatically increases the survival rates.
Are there other applications for this sort of technology as well for AI?
Yeah, so we're seeing really entering into a new era of healthcare where we're starting to see AI applications develop for all kinds of support systems for doctors.
What sort of other things?
So we're seeing it right across the diagnostic spectrum, from diagnosing heart disease to all different types of cancer. But we're also seeing it being used to improve how doctors perform the workflow of surgery and to better manage their time as well.
And is this because, I'm being really simplistic here, it's just that it can look at it much faster? There's the computations. Is that what's making the difference?
Yeah, so we had a dramatic shift in the technology in the past few years where we started to see machine learning techniques that can really perform extremely well. And they're able to look at an enormous amount of information very, very quickly and make very high quality decisions.
In terms of availability then, is this, if people are watching this morning thinking, okay, this sounds amazing, how can they get it? How widely available might it be? And where would it be rolled out?
Absolutely. So one of the really exciting things about this project is we're developing technology that could be put anywhere on Earth, and that's really powered by that satellite technology. We'll be going to a clinical pilot in the next year, and then we'll be looking to roll it out to patients in the next 2 to 3 years.
Right, and is it expensive?
So our goal is to be cost positive for the NHS, which means actually we will save the NHS money.
And have you any indication at this point, can you put any kind of figures on how many lives this might actually make a difference to and potentially save?
So it's a bit early because we're at the start of the project to make those kind of statements, but there's over 40,000 people are diagnosed with bowel cancer each year. There's 16,000 deaths per year related to bowel cancer. So we'll be looking to play our part in using artificial intelligence to reduce those numbers.
What sort of reaction have you had from medical staff, those who work in this field already?
Sure. Very, very positive. So doctors are measured on something called adenoma detection rate, so how many of those polyps or how many of those cancers they detect, and our software can improve that for them. So we believe we're going to see a shift and a differentiation between doctors who are using AI and doctors who aren't.
Thank you very much indeed. And just, I'm sure lots of you are aware, it is, I think it's Bowel Cancer Awareness Month at the moment. So there's lots of information kind of online, various different places about how to, what the signs are as well. So really interesting talking to you.
It sounds quite crude, but it's like VAR for bowel cancer, isn't it, really?
It is, that's exactly what it's like. Yep.
So it's incredible. And like you say, I know you can't project how many lives might be saved, but if it works and it's able to help with early detection, then it's a genuine lifesaver, isn't it?
Yeah, so we're really excited about the lives we can save, but also the improvement in quality of life we can give to patients with bowel cancer. If it's detected late, it really can be devastating.
Peter Mountney, really good to talk to you. Thank you very much indeed. Thanks.